Thanks for your interest in joint pain treatment options at Schneck Orthopedics and Sports Medicine. You've come to the right place. Schneck Orthopedics has received the Joint Commission's Gold Seal of Approval for our knee and hip replacement programs. Schneck is one of only 7 centers in Indiana to earn certifications for both knee and hip replacement. We have also earned Blue Distinction from Anthem Blue Cross and Blue Shield for our quality care, treatment, and expertise and better results in addition to affordable care. Our surgeons are all board certified. They offer the latest innovative procedures, both non-surgical and surgical. Advanced surgical procedures with Schneck, such as anterior hip replacement and visionary knee replacement, mean our patients enjoy faster recovery times with less pain and smaller incisions. Schneck is a Baldrige Award winner and a magnet-designated hospital. When you choose Schneck for your joint replacement, our team, which includes Schneck orthopedic surgeons, our bone and joint center, including a nurse navigator, and our Schneck Rehabilitation Center, will all be invested in your care and successful outcome.
Schneck Orthopedics and Sports Medicine is your best choice for quality care and joint replacements. But how do you know if you're ready for a replacement surgery? At Schneck, our surgeons will do a thorough evaluation to discover the best treatment plan for your joint pain. A key component is also a healthy body and healthy body weight. 10 pounds off of your body equates to 30 to 40 pounds off of your knee. There are multiple non-surgical interventions that will help with joint pain, such as cortisone injections, bracing, arthritis medication, and physical therapy. We offer hyaluronic injections that have been shown to delay knee replacement by 3 to 5 years. And we do offer platelet-rich plasma or PRP injections as well. When these non-surgical treatments no longer bring relief, it may be time to consider surgery.
We are glad you are considering Schneck Orthopedics for your joint pain treatment. Next, you'll learn more about the specific treatments available from our surgeons. After that, Carrie and Holly from our Bone and Joint Center and Rehab Center will discuss what happens after a joint replacement surgery. You will not be alone after your procedures at Schneck Orthopedics. Our nurse navigator and rehab team keep you on track and get you back to the activities you enjoyed before joint pain slowed you down. Joint pain treatment is a team effort, and we are with you throughout your journey. Thanks for choosing Schneck.
Hi, I'm Dr. Chris Williams, an orthopedic surgeon here at Schneck Orthopedics and Sports Medicine, and I'm excited to tell you about hip replacement here at Schneck. Dr. Girth, Dr. Michaels, and I are surgeons that you'll see for your hip pain and hip replacement surgery. Together we have over 45 years of experience and combined have done thousands of these procedures. Because we want the absolute best outcome for our patients, we are proud to offer anterior hip replacement. Schneck is the only hospital in our area to offer this muscle-sparing approach. In anterior hip replacement, the incision is made at the front of the hip, allowing access to the joint through a natural interval between muscles. This allows the joint stability and function to remain intact. It also reduces post-operative pain and allows for an earlier recovery. So who is a candidate for hip replacement? Well, anyone suffering from arthritis can benefit from this less invasive approach. Even patients with severe deformities, trauma, or who've had previous replacements may be a candidate for the anterior replacement. Of course, the size or weight of a patient is always a consideration when discussing a joint replacement. Traditionally, most hip replacements last about 10 to 15 years. We use VariLast technology for hip replacement, and VariLast is a longer lasting hypoallergenic option. These replacements can last 30 years, twice that of a traditional implant. Your therapy team will begin working on you day 1 after surgery. Patients who have an early morning surgery may be up and walking the same day. We want you to strengthen those muscles and maximize flexion to ensure your best outcome. After your therapy treatment plan is complete, you may feel years younger than expected. That is our goal, to get you back to the activities you enjoy pain-free. Be sure to sign up for a consultation. A consultation and evaluation gives us the best opportunity to see if you are a candidate for surgery, or if we can recommend a more conservative treatment for your hip pain. One question that I often get asked about hip replacement surgery is how long is the recovery? I typically do surgery on a Tuesday. Most of my patients will go home either Wednesday or Thursday, so it's just 1 or 2 nights in the hospital. By the time you leave the hospital, you'll be working with physical therapy, you'll be walking with a walker, able to do some stairs, and then we get you home. At that point, you will undergo some physical therapy. Typically, it's about 4 weeks of physical therapy. In about 6 weeks, you're feeling really pretty good, and in about 3 months, you're not thinking about it anymore. Another question that I get asked about hip replacement surgery, especially anterior approach, are what are the restrictions? In a traditional hip replacement that is done through the posterior part of the hip, patients have restrictions like not being able to cross their legs a certain way or lay a certain way in bed. But one of the advantages to anterior hip replacement is that there really are not any restrictions on your activity. Whatever you feel comfortable doing, you can do safely. Yet another question that I get about joint replacement in general are what are the potential complications for joint replacement? The thing that we worry about the most is infection, because that can be a devastating complication. If the bacteria are able to get deep to the metal parts, then sometimes the parts have to come back out, and that is a really big deal. But here at Schneck, we do a lot of things to help prevent infection, and because we do that, our infection rate is well below the national average. Stay tuned for more information on what happens after surgery. Thanks for watching. I look forward to meeting you.
Hi, I'm Carrie Johnson. I'm a nurse navigator for the Bone and Joint Center at Schneck. I work with Schneck Orthopedics and rehab teams to help you through your joint replacement journey at Schneck. The Bone and Joint Center is a unit at Schneck Medical Center where you will stay after your surgery with one of our orthopedic surgeons. Your journey begins when you and your surgeon decide joint replacement surgery is right for you. As we plan for your surgery, you'll meet me. We will have various tests to prepare for surgery and meet more Schneck staff along the way. On the day of your surgery, you'll meet your anesthesiologist and surgery support staff in pre-op and post-op. When you stay overnight in the hospital, you'll be seen by one of our hospitalist physicians who treat patients only while they're in the hospital. You can also expect your surgeon to be following up and checking in on you. You will also meet physical therapists who will have you up and walking and using your new joint. The therapist will get you used to your new joint and ready to go home. After you leave the hospital, you will still hear from me to set up your physical therapy appointments and to make sure you are doing well.
Hello, I'm Holly Wishmeyer. I'm a physical therapist and the Director of Rehab Services here at Schneck. Our team will work with you to get you back to the activities you enjoy. Members of my staff will work with you while you're in the hospital and also start your outpatient therapy. If you're not able to do outpatient therapy, we offer services through our home health care department. We have an amazing outpatient staff, and our therapists are always excited to work with joint replacement patients. Most patients are amazed with how great they feel with their new joints, and our goal is to get you back to being active, while ensuring you are stable and well aligned for the future.
You have now seen what our team can offer you. We always put our patients first at Schneck, and we are looking forward to helping you live the best quality of life possible. Sign up today and get moving toward a pain-free way of life. You may qualify for a free x-ray.